All right, so we are in the week of September 21st to the 24th, so we are going to be covering articulations of the muscular system. On Wednesday, you'll also have your quiz over skeletal system. So you have 25 questions to be multiple choice. You have a word bank, okay, to choose from. You'll have pictures. You'll have to identify things like the uh, different bones or different structures, things like that. So things that we went over last week. All right. So that's essentially what it would be about. Some things will be like naming the bones. Some will be naming some of those structures and the anatomy of the bone. Okay. But things that are in the study guide. Okay. All right. So let's move on to let's see, go down to week 6. We'll do that. Practical 2 study guide. Let's see, make sure. Yeah. So we're in week 6. Let's do the practical 2 study guide with the labels. All right, so we already covered integumentary system and most of the skeletal system. Let's get to articulations. All right, so different kinds of joints. So up here, all the ones, well, I'm actually going to draw a line first. So, okay, make a line here, make a line here. We'll draw a line across. Okay. All right, so the ones over here. So these are all cartilaginous joints. Yes. Yeah, I'll switch it because what you have is the same, but it'll probably be easier for you to read if you look at it on the screen here. So, all right. There we go. All right. So, ones in the middle, these are fibrous joints. Ones for here, these are synovial joints. Yeah. All right. So in the cartilaginous category, these joints here, the sternum, the clavicle area, all these synchrondosis is plural, synchrondosis is singular. Put that right there. Okay. These joints in between the vertebrae. All right, these are called symphyses. Symphysis is singular. This is also a symphysis down here, the pubic symphysis. Okay. Now these joints in the middle. So this is a suture. Okay, fusing those bones together. All right, now I'm actually gonna, so that's a little hard to see. I hope this doesn't mess everything up. Okay, so yeah, we'll leave it like that. So this one that's down here, so this one, we will call that syndesmosis. It's also a fibrous joint. And you see that kind of holding the tibia and the fibula together in your lower leg. So over here, this ball and socket joint is called multi-axial because it has multiple planes of motion. So you can move your arm up or back, you can move your arm out, back in, you can move your shoulder in and out, go in a circle. You have multiple planes of motion where you can move that joint. Okay, your elbow joint is uniaxial. Okay, because you only can really move it in one plane of motion. Now the bones in your wrist, your carpal bones, are considered biaxial. In the sense that they are, the way they're shaped, you can kind of move your, if you think about it, you can move your wrists side to side or front to back. Okay, 2 planes of motion. All right. So some terms that definitely want you to know. Okay.
That was for the uniaxial?
This one right here is uniaxial because it's one plane of motion for the knee or the elbow joint. This one, yeah. Biaxial, 2 planes of motion. Okay, so save that. I'm going to clear, drawing, move on. All right, let me reduce this just a little bit. So in the joint, this is a synovial joint. Okay, so out here you have a ligament connecting bone to bone. That's what ligaments do. The inside of your joint, you have a space called a joint cavity. Inside that joint cavity, because this is a synovial joint, it has synovial fluid in it. Okay, it's a cushion. Okay. Now, on either end of these bones here, you have a layer around the bone of what we call articular cartilage. Okay, it's made up of hyaline cartilage that we learned about before. Right, and you also have along the sides what we call synovial membrane. Okay, synovial joint has synovial membrane. Now, just superficial to that synovial membrane is a fibrous layer. Okay. So it's a harder layer. Now, when you combine the fibrous layer and the synovial membrane, we call that the articular capsule. Okay, and that essentially holds the cavity in place. Okay, keeps your elbow joint, your knee joint, in place so that it can handle shock between the, running, jumping, walking. All right, let's talk a little bit about movements. Okay, so they talk about that you can classify the joints in terms of their structure, which is what we just did. So let's now talk about joints in terms of their function. So anytime you, in a sense, decrease the angle in a joint, that's called flexion. Okay. Anytime you increase the angle in a joint, that's called extension. And for some joints, you can essentially go past what would be considered normal extension, and we call that hyperextension. So in this case, with the arms, if you move your arm up, in a sense, you're flexing that shoulder joint. Bring it back, you're extending. All right, now if you move your arms back, past your back and your midline, past it, that's considered hyperextension. Okay. Like that would just be even more hyperextension. This is flexion. Okay, so like you have flexion, extension, hyperextension. Okay. Same with the legs. So at the knee joint, so if I'm decreasing the angle at my knee joint, I'm flexing my knee joint. If I increase the angle, I'm extending my knee joint. Now with my hip joint, so if you think about this angle here, I'm decreasing the angle with my hip joint. Now if I move it back, I'm increasing the angle. It's essentially from here to there. Like from my shoulder to my foot. You decrease the angle. It was 180 degrees. Now it's less than 180 degrees. Bring it back to 180 degrees is extension. Going back with my leg, that's hyperextension. Okay. All right, rotation. So with some joints, you can do rotation. It's like your neck. If you turn your neck to the left or to the right, that's considered rotation. Now with your arms or your feet, so if you turn your body or turn your arms out, so your palms are facing out, that's considered lateral rotation. Or like think about your thumbs. If you move your thumbs out, you're going away from the midline. It's lateral rotation. You move your thumbs in, it's medial rotation. Okay? But that we're talking about that with our whole arm. Okay? Same with your feet. Okay? Rotate your toes out. It's lateral rotation. You rotate your toes back in, it's medial rotation. Okay. You can also describe joints in terms of kind of moving along the plane of your body, right, in the frontal plane. So if you, in a sense, if this is normal anatomical position, this is increasing the angle between your leg and your hand. Okay, that's abducting. Okay, this is abduction. Coming back in is adduction. Okay, perhaps you've worked out at a gym and you've seen leg adductors and leg abductor machines. Okay, so if you're sitting down on those machines, if you move your leg out, okay, that's abduction. If you're having to press and move your leg back in, it's adduction. Now, if you take your arms, you rotate them like this, okay, that's circumduction because you're kind of going in a circle. Okay. All right. So we covered this part. Now let's talk about some of these other movements. So with your feet, if you move your toes up, palm or the sole of your foot down, that's considered dorsiflexion. And then if you plant your toes down, kind of like there's a thing with like the ballerinas, right? So that's plantar flexion. So toes up, dorsiflexion. Toes down, plantar flexion. And if you move your foot at your ankle, you move your toes in, it's inversion. Move them out, it's eversion. All right, so with your hands, you have movements we call pronation and supination. So in anatomical position, your hands are naturally supinated, okay? Your radius and your ulna are parallel. Now, if you turn your hand over, that's pronation, okay? Your radius is rotating over your ulna, okay? So here you're going back, putting the palms out, that is supination. All right, so pronation, supination, pronation, supination. Okay. Now, one of the features of being advanced animals, we have opposable thumbs, right? So only a few species have opposable thumbs. So that basically what that means is you can essentially press your thumb against your fingers, okay? All right, that's called opposition. All right, so I'm gonna give you all a minute. Talk with your partner about what you've learned about articulations. So talk about classifying joints by structure. You can also talk about classifying joints by function.
Okay, inversion.
Okay, so with the muscular system, we'll talk about a few different things. We're going to start with muscles of the head and neck. Okay, you've got those of you who are here in class have some models that are at your tables. If you're watching this at home, you can go to practice anatomy lab inside of Mastering A&P in your lecture. So in the lecture class, you have access to Mastering A&P. You can go into the practice anatomy lab. You can usually find it in the study area. You can look at the muscles of the body. You also have some access to some games, okay, purpose games that are in the study or in the modules in Canvas. All right, so part of the reason why we had you learn all those body landmarks and all of those bones, part of that is a lot of what you see with the muscles is very similar. So if you learn those names, these names aren't as difficult to learn. So on the forehead, just superior to the frontal bone is the frontalis muscle, okay? Attaching to the temporal bone is the temporalis muscle. Attaching to the occipital bone is the occipitalis muscle. Okay. All right, so going around the eye, making an orbit around the eye is the orbicularis oculi, okay? Oculi meaning eye, right? You have another orbit around your mouth, which is the oral region, right? So this is orbicularis oris. Okay, all right. You have this kind of two-headed muscle here. Okay, so it's the masseter. If you think about it, based on its location and its name, it helps you chew, right? Helps you eat mass, right? So it's the masseter.
So
All right.
it's so on the picture, it's the pink one, not the white, right?
It is these two muscles right here. Now, you have this muscle that kind of goes from your head down your neck. That is your sternocleidomastoid, okay? Kind of helps with turning your basically dropping your head to the left or to the right. Now, in the back of the head and the back of your body, you have a big muscle called the trapezius, okay? We'll see another view of that on the posterior surface of the body. Okay, but these are the main muscles of the head and neck that we want you to know. All right, let's look at muscles on the anterior surface. Okay, you can still see a bit of that trapezius muscle there. Okay, so kind of if you think about it, if you're shrugging your shoulders, you're moving your trapezius. Okay, you can also see the sternocleidomastoid. The shoulder muscles are the deltoid muscles. Remember the deltoid region? In your chest area, you have pectoralis major. In your arm, upper arm, on the anterior surface, you have the biceps brachii because it has two heads. And more, you can see a bit of it, but on the posterior side of the arm, you have the triceps brachii with three heads. Okay, large muscle in the forearm we want you to know is the brachioradialis or brachioradialis. And to help you remember this name, brachio means arm, radialis has to do with the radius, right? Radius is, I told you when you're in anatomical position, it is on the thumb side of the arm. So should help you remember that. Now in your abdomen, you have another couple of muscles we want you to know. We want you to know the external obliques. Okay. The oblique plane is more diagonal. So these are muscles that run diagonally in your abdomen. And just deep to this connective tissue structure right here are the rectus abdominis muscles. And those kind of run up and down. Okay. In your thigh, you have your area we typically refer to as quadriceps. Specifically, this muscle in that region is the rectus femoris muscle. Right on the anterior surface of your lower leg, you have a muscle called tibialis anterior. Okay, it should make sense because it's on the anterior side and it's attaching to the tibia muscle, or tibia bone, excuse me. So it's attaching to the tibia bone. Now, we'll talk about our calf muscles. That large muscle there is your gastrocnemius. Mm-hmm. I'll have to research that and get back to you. I just always know that is the name, but I'll have to get back to you on that. So those are the anterior surface muscles. On the posterior surface, again, you can see the occipitalis on the occipital bone. You see a bit of the sternocleidomastoid. You see a large view of the trapezius. Okay, another view of the deltoid in the shoulder. Large view of the triceps brachii. Okay. So this large muscle in the lower back is the latissimus dorsi. So if you're doing a lot of rowing, rowing a boat or doing a row machine, you're working out latissimus dorsi, okay, dumbbell rows, things like that. All right. So these, obviously, these are your gluteal muscles. Smaller muscle, gluteus medius. Larger muscles, the gluteus maximus. Okay, in the back, the posterior surface of the leg, we have the hamstring muscles. Specifically, this muscle is biceps femoris. Another view of the gastrocnemius. Okay. So there are lots and lots more muscles in the human body, but these are the ones that we want you to know, okay? Now, you also need to know the actions of some of these muscles. Okay, so we provided a list for you here. Think about it. Biceps brachii. If you flex your biceps, you're flexing your elbow joint. Okay, biceps brachii also helps you to supinate your forearm. Your biceps femoris in your leg helps you flex your knee. Also can help in extending your hip. Also allows you to do some lateral rotation in your knee. Your brachioradialis helps you flex your forearm. Deltoid. So if the shoulder muscles contract, you're going to pull your arms up. So it's going to abduct your arm. The external obliques, when they contract, allows you to laterally flex your trunk, right? So if you're doing side crunches, right? Also allows you to do some rotation of your trunk, okay? Gastrocnemius, remember we learned about this type of action? Plantar flexes your foot. So if you press, you have your toes on the ground. So if you're working out that muscle, you're doing plantar flexion. The frontalis muscle raises your eyebrows. So in my mind, my classic example of that is Dwayne Johnson when he used to be the Rock, the wrestler. You probably don't remember that, but he used to make his eyebrow go up. So he was using his frontalis muscle very carefully, right? So gluteus maximus. Actually, it has a role, not just something that people see, from an appearance standpoint, but it actually extends your hip, okay? So if you flex it, you're actually extending your hip. So if you think about when you run, when you press down on the ground and extend your arm, or extend your leg, you're also flexing your gluteus maximus. All right, so gluteus medius helps you abduct your thigh, moving your leg out. It also helps you with some medial rotation. Latissimus dorsi serves to extend, adduct, and medially rotate your arm. So it helps you bring your arms back in. Okay, so it can help you extend your arm. So bring your arms down, right? Or bring them back in. So I don't know if you've seen people work out and doing cable, or they pull the cables down. That's working in there. Latissimus dorsi. All right. The mass eater helps you close your jaw. Okay, also helps you elevate your mandible, which is your lower jaw, right? For chewing. Occipitalis muscle, it actually pulls the scalp posterior to the back. Your orbicularis oculi allows you to close your eyes, allows you to blink or to squint. Your orbicularis oris allows you to close your lips, also used during kissing. Okay, pectoralis major. So it actually helps to flex your arm. So if you're moving your arm up this way, you're working your pectoralis major muscle. Okay, also helps you adduct your arm and also medially rotate the arm. Rectus abdominis, okay, in the abdomen helps you to flex your vertebral column. So that's flexing is like doing a crunch or sit up. Okay, so you're flexing your vertebral column. Also helps you with some rotation of the vertebral column. Okay, rectus femoris Okay, you can do some extension of the knee. Remember, this is in the leg. So it's in the back of the leg. So when it contracts, if you think about it, if you have your leg and you have this muscle, you have a tendon underneath the back of your leg. So when it pulls, so in a sense, your rectus femoris, so your rectus femoris, when it contracts up here, it'll pull your knee up, but the biceps femoris in the back will contract. Okay. So remember, rectus femoris is going to be in the anterior part of your leg. Biceps femoris will be on the posterior side. Your sternocleidomastoid flexes your neck. So it helps you to, if it contracts, it's going to pull your head down, flex your neck. Helps you to rotate your head. So if you're contracting one more than the other. Temporalis muscle helps you close your jaw, but it also elevates the mandible. So it works in conjunction with the masseter or masseter. Your tibialis anterior. Let's see. Yeah. All right. So your tibialis anterior dorsiflexes the foot. So remember, dorsiflex is moving the toes up. Because again, tibialis anterior is in the front of your leg. So if it contracts, it's pulling on the front surface. So if it pulls along the front, it's pulling your toes up. Your trapezius muscle extends your neck, so it's going to bring your neck back. So it opposes the sternocleidomastoid. In your triceps brachii, let's see, it extends your forearm. Okay. So, like the biceps flexes your forearm, your arm, and your triceps brachii extends your arm. So, and sometimes it's easier to remember these muscles actions by matching with the opposing muscle. You can kind of remember one does one does the opposite. Flashcards are really good for this. The games are really good for this. Quizlet, there's a lot of quizzes out there that have the actions on there. So practice makes perfect. So what I'd like you to do now is to discuss with your partner what you learned about the muscular system, and then you can do your exit ticket where you're providing your clear point, which you did understand, and your muddy point, which you didn't understand. And if you're at home, you can still do the clear point and muddy point inside the discussion in Canvas.